today we're going to talk about the Belmont Rapid Infuser that we have here at Swedish American. This lives outside OR room 10. It should be plugged in when not in use. So if you need this for a trauma case or a patient that you expect is going to need a lot of blood products, you unplug it from the wall, bring it into your room, and you will also need two other components. You will need the sterile setup that is kept either down in SSA. There's one in the bottom drawer of our trauma cart, and it's also kept in our hardcore Omnicell. The other thing you will need is fluid to prime it with. Two different fluids are okay for use with this. Sometimes we have Normasol, sometimes we have Plasmolite. They're the same thing. It just depends on whether or not we have a back order on one of the fluids. So you may see Normasol, you may see Plasmolite, but either are okay to prime this machine with. The machine does have kind of a quick set instruction on it if you have any questions or need to look at something as a reference. But for setup, you're going to open this door here. There's a big clamp on it. Open it up. And then you'll see everything on the inside is color coded. Your tubing is also color coded. So just kind of match light colors with light. Your disc has an arrow on it that's going to be facing upwards. And follow your red tubing around. Kind of plug all the tubing into the logical spaces. Make sure everything is pushed in really well, otherwise when you go to close this door at the end, you might crimp something. Follow this around. This little cartridge has an arrow on it that needs to be pointing towards the machine as you put it in. And again, make sure all tubing connected to it is fed in and nothing sticking out. Once you have that all in, you can close the door. It is kind of a tight squeeze to shut it. Push the clamp down. This is your reservoir. This is the reservoir holder. You're going to click it in here. Just kind of put it at a height where you're not crimping any of the tubing, but you're also not stretching it. This is going to be your patient line. You can put an extension on it if you need more length. We just use our regular IV tubing extensions for it. And then you're going to have 3 spikes. 2 of the spikes are going to be for blood products. 1 of the spikes is going to be for your priming solution. Make sure they're all clamped before you plug any bags in so you don't get fluid all over you. So you're going to hang either your Normasol or your Plasmolite. Spike your fluid, unclamp the clamp, and you're going to turn on the machine. The button is on the back of the machine. Make sure it clicks when you turn it on. It's going to take a couple seconds to warm up, and then it has directions on this screen that's going to walk you through priming it. So right now it's got a button on the lower right hand side that says prime. You're going to push it. It's going to prime the fluid through, all the way through the mechanism. And once it's done, it'll stop. So now it's done priming, but you're going to want to finish priming this patient line so that you don't have any bubbles in it when you hook it up to the patient's IV. So you're going to push patient line prime. Hold it down, and it's going to prime all of the bubbles out of the tubing. And when you think it looks good, press stop, and then you're ready until the patient comes into the room. Once the patient's in the room, you're going to hook it up. When anesthesia is ready for you to give blood, you're going to get your checked blood. You're going to hang it, and you're going to use one of your 2 other spikes. You're going to go ahead and spike your blood. It's probably good to clamp off this priming fluid now so you don't get backflow of the blood into your priming fluid. You're going to unclamp your blood bag. Once it's hooked up to the patient, you're going to go ahead and hit the infuse button, and it's going to start infusing blood into your patient. You can adjust the volume, the rate of the fluid delivery. It can go up to 500 mLs per minute. Kind of just ask anesthesia what they want it at. They'll tell you, and you can toggle these buttons to increase or decrease your rate. The bigger IV, the better. If you have a central line, that's even better. That's going to get the fluid in faster. A couple other things about this machine. All of this has a heating element in it, so you can put whole blood and FFP through this. They can be heated. Platelets cannot go through this because they can't be warmed. So if you are giving platelets and anesthesia wants them given through the rapid infuser as well, you can still give them through here, but you should plug it in to this one-way port so that you bypass the heating element. When you're done with the case, everything gets torn down and put into a red bag. The machine can be cleaned off with Virex and put back outside room 10 and plugged in. Thank you.